here we go. Okay, so I'm going to start recording. All right, so B-Waiver evaluation for tuberculosis. Again, this is just a very, very general overview of what they are and the whole entire practice of evaluating them. So in TB, we love our acronyms. This is a list of the different acronyms that are going to be in this presentation. Go ahead and take a look at it. The ones that you may not be familiar with, for example, might be EDN, and that's the CDC Electronic Disease Notification System. That's how we're notified of B-Waiver immigrants over at OHA. And also some of the larger counties also have direct access to that system, but not everybody does. I think the others you may be more familiar with, but take a look if you're not. Okay. So our basic objectives are today is just to gain an understanding of what happens overseas with the immigrant before they come to the US, and then to try to improve your comfort with interpreting the B-Waiver paperwork, and then to understand the different types of B-Waivers that you might get and some potential follow-up actions, and then learn just some tips for completing the paperwork that needs to be filled out. Okay, so for those of you that might not be as familiar with TB, here is just a quick review of TB testing and how it works. This is testing basically for latent TB and also TB disease. So TB skin test, we don't see it used too much anymore. I think it's kind of starting to fade from the picture. But an important thing to remember with this population that's immigrating from overseas is that the TB skin test can be falsely positive if the person has been BCG vaccinated. So it's not a great test for people who are foreign-born. Sometimes we still get kids that are B-Waivers that were tested overseas that have had a TB skin test, and there's a decent chance that they're falsely positive. I predict that someday in the future, we're not going to be using TB skin tests anymore, but for now, they're still around. Then there's the quantiferon test. This is an IGRA, or interferon gamma release assay, which is used overseas to test kids, and we'll talk about that a little bit more. You may also use it here to test adults and kids. So we recommend quantiferon or T-spot tests for LTBI testing for immigrants because they've had BCG, and those two tests do not respond. Sorry, just letting a couple more people in. Those two tests will not be falsely positive because of BCG, so we recommend those for screening immigrants. Chest x-rays. So as we'll find out during the presentation, only adult B-Waivers come with chest x-rays. The thing to remember about chest x-rays is that they're not very specific. They can be hard to interpret. They could improve since the person left their home country, worsen, or even stay the same over time. So a lot of times you'll find when a B-Waiver immigrant arrives with an abnormal chest x-ray, you may do a new chest x-ray and you'll find out it's entirely normal. So that does happen, and there's a bunch of reasons why. Sputum, we use sputum collection to diagnose TB disease. And with sputum, we always collect 3, and they need to be at least 8 hours apart, and 1 should be in the morning to rule out TB disease. An important thing to remember is TB disease can wax and wane. So sometimes people get more sick with TB or sicker with TB, and then other times they'll get better. So with our B-Waiver immigrants, you're going to see that the adults have many times already had sputum collected overseas, and they're all negative. Sometimes we will want you or ask you to collect sputum again, just because of this very reason that sometimes TB disease can wax and wane or get worse. Okay. So I'm also going to quickly review the different regimens to treat latent TB infection, just so you remember. Let's see. Okay. So you see what they are. So right now we're recommending for most people who have latent TB infection, rifampin 600 milligrams and INH 300 milligrams daily for 3 months. And for kids, this is going to be weight-based. And we're recommending this because, as you recall, there's currently a rifampin shortage. I think it's getting a little better, but we don't know. So we hope that we can save a little rifampin by using that regimen. The other regimen that I like a lot is rifampin 600 milligrams daily for 4 months. And again, with kids, it's weight-based, no age limit. But as with any of the rifampin-based regimens, it can interact with many other medications. So that is always something to keep in mind. Rifampin can interact with birth control, it can interact with Coumadin, all kinds of critical medications. So just be careful, you do a careful drug-drug interaction check. Another good fast regimen is the 12-dose once weekly INH and rifapentine regimen. And there are dosing tables for this. The person must be older than 2 years old. And the things that are kind of problematic with this regimen is that there are a lot of pills and also it can interact with many medications because of the rifapentine. I see a question. Will I be sending the slides to follow? Yes. Yep, I'm going to send the slides to follow and then also the recording. So everybody will end up getting that. All right, and then the final LTBI regimen is INH, 300 milligrams daily for 9 months. For kids, it's also weight-based. So this currently isn't a preferred regimen because it's so long and it has a lot of hepatotoxicity. But it is the best and really only choice for those people who might have interactions with rifampin. So there you go. That's your quick review. So a little bit of background about overseas screening and treatment. So immigrants overseas who want to become permanent US residents must undergo medical screening. Now I emphasize the word permanent there because this means that it does not include people who are seeking work visas, student visas, who are just coming to the US on their own or anything else. Only people who want to stay here permanently. Now, what happens is the CDC works with what's called panel physicians overseas who complete the medical screening. And TB is just one element of this health screening. If you're curious at all, you can go to that link there and you can find the full set of instructions for the panel physicians. Now, one thing to note, because it is confusing, is this is not the same as civil surgeon screening. Civil surgeon screening is conducted for people who are already in the US that are adjusting their visa status. So people who are in the US that want to become permanent residents, they would go to a civil surgeon. People who are living overseas that want to become permanent residents must go through this panel physician screening overseas before they come. So the US evaluation of B-Waivers, your primary goal is going to be to identify anybody coming into the country with TB disease. And your secondary goal is to test and treat for latent TB infection. So how are you going to get notification about these B-Waiver immigrants? Some local public health departments are going to get it electronically by the electronic disease notification system called EDN. That is run by CDC, and some of the larger health departments just get direct notifications. Otherwise, we at the state get the notification, and then we're going to upload it to Orpheus for you, and we'll leave you a note in Orpheus and send you an email too. The third way you might get a notification is by the immigrant or refugee who just walks in for evaluation before their paperwork arrives. Once in a while, you'll have somebody who's really proactive and they'll come in and they might have a copy of their own paperwork and tell you that they need to be evaluated. So if that happens, you can contact us and we'll see if we can find their paperwork. Usually it's still just on the way or being processed. So B-Waiver paperwork is really confusing. And why is it like that? I don't know. It just is. If I could fix it, I certainly would. It's always been that way. I've been doing TB stuff for a long time. I used to evaluate B-Waiver immigrants too when I was over in LA County, and the paperwork was confusing even 20 years ago. So it's been confusing forever. CDC also has gotten a lot of feedback about it, and they can't fix it either. You'll see if you get a B-Waiver immigrant that there's a lot of information in the paperwork that you really don't need. And all I can say is the more you look at them, the easier it starts to get. So please, if you get paperwork, don't throw it away, don't shred it, don't freak out. We'll help you with it. So when you get this batch of paperwork via Orpheus or EDN, and I say paperwork because it used to all be paper-based, it's electronic now, but what you want to do is review it carefully. And then if you really still don't get it, you can call me and I'll for sure walk through it with you. No problem at all. I'd expect that. You may call me if you don't get them very often or you're new. Also, you could consult with your health officer. And then what we would like you to do is try to contact the immigrant within about 5 business days of getting this notification. I would not consider this to be extremely urgent, right? So if you have other priorities and it takes more than 5 business days, it's okay. If you don't get a response by phone or letter, you should probably go ahead and try another method. If you have the resources, a home visit could be a great idea. That's what I used to do in LA County, and oftentimes I'd find my immigrants that way. Or you could send a certified letter or something like that. I usually recommend if you're not able to find the person within 30 days, you just close the case up as unable to locate, and we can help you close it if that's what happens. One thing to note is, sometimes people will arrive in the United States intending to stay permanently, and then they change their mind. Like I remember when I was in LA, I went to find a B-Waiver immigrant, and they had already left because they thought it was too cold in LA. So people don't always stay. Sometimes they'll go to another person's house or move before you have a chance to find them. Actually, another point I should make here is, if a B-Waiver immigrant arrives in the country and you're not able to catch up with them, or they refuse to be screened or to see you, that's not going to affect their immigration status at all. We want them to go through this screening process again for their own health and for the health of the community, but there is absolutely no implications for their immigration status if they refuse to work with you. So just so you know. Okay. Question you may or may not know the answer to, and you can just think the answer to yourself. You are required to provide all TB testing and treat latent TB infection for B-Waiver immigrants. Is that true or false? Just think about it a minute and then I'll give you the answer. All right. Okay, so the answer is false. So your job really is to ensure that the appropriate evaluation and treatment occurs, and then to submit the paperwork afterwards. So you can refer the patient for clinical services, but really, I feel like it should be at no cost to the B-Waiver immigrant, right? Because we're asking them to do this as part of public health. We can reimburse you guys for the IGRA, that is the T-spot or quantiferon, and the chest X-ray if the patient goes through you. And of course, we can also provide you with medications to treat latent TB infection. So you can absolutely refer the person if you'd like. Okay, so now we're going to kind of go through the whole process. As you can see, these are called B-Waiver immigrants. I just want to let you know that there are also A-waivers. These people are people that have active TB disease in the State Department or somebody else is allowing them to come into the US with TB disease. They're very rare. I think in my entire time at the state of about 13 years, I've maybe only seen 2, and I believe that it was a child. So there you go. So I kind of put together some goofy visual cues because this can be a little confusing. If you see the airplane, that's the screening that's being done overseas before the immigrant arrives. And then that little EA Oregon is what you all would do when the patient actually gets to the US. So this is about the overseas panel physician screening. And this applies to adults who are older than 15. And this would be what is categorized as a class B1. So for adults, they do not get a TB skin test, a quantiferon test, or a T-spot test. That's only kids. Adults will not get that overseas. you may find in Orpheus or on EDN a digital chest X-ray, or sometimes the applicant is still given a CD. So they might have it with them, or you might find it uploaded into Orpheus or an EDN. So if this adult is symptomatic for TB, or they have a chest X-ray abnormality that's indicative of TB, or they're HIV positive, the panel physician is required to collect 3 sputum and do a smear, culture, and susceptibilities before the person can come to the US. If the cultures are negative, the applicant can go ahead and move on to the US. But if the applicant has TB disease, they're going to be treated overseas with DOT prior to being allowed to immigrate. So that's kind of the process. Now, anybody with an abnormal chest X-ray is going to be referred to the LPHA through the EDN system, and this would be considered a Class B1. So this is what you do when you get a Class B1. You're going to first take a look at the paperwork carefully. One of your first questions you might ask yourself, is this an adult? And when you look at the paperwork, were they treated overseas for TB disease, or did they just have an abnormal chest X-ray? Sometimes people have had a past history of treatment due to this immigration screening, or they just have
Are you looking for Marianne? Oh yeah, this is hers. Yep.
Uh-oh. Okay. Hold on, let me see. Okay, hopefully everybody's muted now. Okay, there we go. Sorry about that. All right. So sometimes people have been treated for TB disease as part of this whole screening process, or maybe they just have a distant history of being treated for TB disease as a child or something like that. So then you look at that, kind of get a good understanding of it, and then you go ahead and locate the patient. You'll see the address and stuff of the sponsor listed on the paperwork. And when you find the patient, you're going to find out if they have any symptoms of TB. If they do, you probably want to send them right away for a chest X-ray and maybe begin some sputum collection to rule out TB disease. So secondary questions you'll go on to ask yourself and the patient. Does the patient have a CD of their overseas chest X-ray, or is it in Orpheus or on EDN? Most of the time, you'll find it somewhere. And then what you do is you'll send this patient for a chest X-ray using our program for reimbursement, and also send the patient for quantiferin or T-spot test for latent TB infection testing. So when the patient gets to the radiologist, you can have the patient take the CD with them, or perhaps you can push the image to the radiologist. And what you want them to do is to compare the old to the new chest X-ray and provide you with the report of the findings. So that's the general gist of it. Sometimes you don't have a copy of the overseas chest X-ray, and that's okay. Just send them for a new chest X-ray. All right. So in general, this is what happens. So if the new chest X-ray is normal and the quantiferin or T-spot is negative, you're completely done with the evaluation, right? Nothing going on. If the new chest X-ray is normal and the quantiferin or T-spot is positive, then you're going to want to treat the person for latent TB infection or refer them for that. Now, if the new chest X-ray is not normal, at that point, you're probably going to want to consult with somebody else, your health officer, a TB specialist, or our program for next steps. And just for your own information, what we really look for is, again, we want to sometimes see if that chest X-ray got worse. Is it stable? Does it really, really look like the person has TB? You know, if it's stable, sometimes we'll say, okay, they're fine, you know, maybe just treat them for LTBI if they have it. If the chest X-ray is not stable, it's getting worse, or it really looks like it's TB, we may ask you to collect sputum again to make sure that they don't have TB disease. Okay, so do I have any questions right now about screening adults, the Class B1s? Screening or evaluation. You can take yourself off mute if it's easier to ask in person. I don't think I see anything in chat.
So Heidi, if somebody's tested overseas and they have an abnormal chest X-ray but were treated in the past, do they get treatment again just because they have that abnormal chest X-ray and want to come to the United States?
Yeah, that's a good question. So if somebody was treated like way in the distance past, right, not as part of their overseas screening, is that what you mean?
Correct. That's what I mean.
Yeah, that can certainly happen. So I think usually what we would recommend in that case is that you try to somehow verify that treatment took place and was correct. And that can be really hard to do. Sometimes in the immigration paperwork, there will be good documentation of the past treatment, and that's acceptable. Otherwise you could try to really inquire with the patient about what the treatment was. Like, for example, were 4 drugs used? How long did you take them for? How many pills? And if it seems like indeed it was treatment for TB disease, then most likely we wouldn't retreat the person for latent TB infection. Yeah, I would say if the chest X-ray is still like highly abnormal and it seems like it's TB, we would probably ask you to collect sputum again. And then of course, if it was positive for TB, we would treat them for TB disease again. But it's really kind of varies depending on the individual patient, I think.
Okay, thank you.
Yeah, sure. Any other questions for me before we move on to the children?
Heidi, this is Wendy from Washington County. I think you addressed this, but just to review, if we do refer out for LTBI treatment, we have to follow up to ensure they completed, or do we just refer out to get them going?
Yeah, so the idea is ideally you will follow up to make sure that they completed, because that's part of what we report to CDC back. If you can't or don't, well, it's not the end of the world, but ideally, yes.
Okay, thank you.
Any other questions? Okay, yeah, and just to Wendy's point again, with the B-Waiver immigrants, I kind of look at it as different priorities, right? Your number one priority is to make sure that nobody has TB disease. And then we kind of move down the line of things. So, ensuring that somebody completed their latent TB infection treatment, it's important, and ideally you would do that. But if something has to drop off because you're too busy, that might be one of the things that just doesn't get done. And it's okay, it's not the end of the world. All right, so this is about, yeah.
Just a quick question. So if we don't know if somebody was treated for LTBI, maybe they were, and let's just say that they were, but we just can't confirm it, and so we choose to, and they agree to be retreated, is there any health consequences of taking medications again?
Okay, yeah, okay, a couple of good points there. So most of the B-Waiver immigrants that are coming into the country, they probably would not have been treated for latent TB infection, because most countries don't treat latent TB infection. So that would be kind of unlikely. It would probably be that they were treated for TB disease in the past. Retreating somebody regardless, though, is not really going to have any consequences for them. That's fine. The only problem is, it's a burden to the patient, because it's a lot of medications to take, and all of the medications can have the potential for hepatotoxicity or other, side effects. So that would be the consequence, right? I hope that answered your question.
Yes, thank you.
Sure. Okay. So here we go. Screening kids 2 to 14 years old, and these are called Class B2s. Only kids from high burden countries are screened with a quantiferin test before they're able to enter the US. And again, this is the same thing. These are just kids that are going to be here permanently in the US, theoretically. If the quantiferin is positive, or they're symptomatic, or they have HIV, a chest X-ray must also be done overseas. And if the chest X-ray is normal, the applicant can leave. Just please note again that these children are not required to complete latent TB infection treatment before they immigrate, right? So we know that they have a positive quantiferin test and a normal chest X-ray, but they're allowed to leave the country before they finish LTBI treatment. So we get these notifications, or you get them, and we'll refer them over to you for evaluation and possible LTBI treatment. And these are considered to be class B2. So what should you do with these? Again, look at the paperwork carefully, and you'll contact the child's parents or sponsors. Of course, your first question, like always, is, are there any symptoms of TB? If yes, you want to rule out TB disease by getting a chest x-ray and collecting sputum ×3. Now, the second tricky part about this, I have to say, is deciding whether or not to repeat that quantiferon test. So a lot of times the documentation that comes will be pretty decent, but it's not always actually a lab result. Some of the states have done kind of studies about what happens when they repeat the quantiferon when the child arrives in country, and they've found a lot of times that it ends up being negative. So at this point, we recommend for the most part that you repeat the quantiferon test just to make sure that it is indeed positive. But it really is up to you. And then go ahead and obtain a new chest x-ray if you decide that that positive is correct, or you get a new positive result. And just a quick reminder, if the child is 4 years or younger, they're going to need a PA and lateral chest x-ray. And if the chest x-ray is normal, you'll go ahead and treat for LTBI. I have a little note there to always use caution if the child is from a hybrid country and they're very, very young. Feel free to consult with us if needed. We don't want to make any mistakes because, you know, young kids in particular are at high risk of developing TB meningitis if they have TB and it's left untreated. So we want to be really cautious on those little guys. Okay, any questions about kids? Okay, doesn't sound like it. All right. So the other category is case contacts, which is class B3. And again, they should, and most of the time are, screened with TB skin test or quantiferon overseas. I think I've seen a couple come through that didn't have any testing, but were just referred to be tested when they get in the US. Just a reminder, if the TST is greater than 5 millimeters or the quantiferon is positive, chest x-ray is going to be done overseas. And that's the same way it works for contacts here. If normal, the chest x-ray, if normal chest x-ray, then we have LTBI. Again, usually these contacts will come over with no LTBI treatment. So they will need to be tested again, maybe, and treated for LTBI when they get here. And again, these would be class B3s contacts. And I think B3s are relatively rare. We don't see them too often, but once in a while they will come through. So what you do again, you know, you'll just review the paperwork. You'll look at if it's an adult and when they were last exposed. So just a reminder for contacts, we need to test them once, and then we test them again 8 to 10 weeks after their last exposure. So you want to know, you know, when they were last exposed. You want to locate the patient and again, check for symptoms of TB. And if it's been more than 8 weeks since the last exposure and the test was negative overseas, you'll need to retest them, ideally with a quantiferon or T-spot. And then if that test is positive, you'll get a chest x-ray. And if normal, treat for LTBI. Any questions about class B3? All right, so a couple questions for you, and you can just think through them and then we'll go through the answers. First one, all B-Waivers will have a positive quantiferon test in their EDN paperwork. True or false? Give you a second. Okay, so the answer to that one is false, right? The kids are going to have a quantiferon test overseas. Oh, thank you, Heather. I see you answered false. Very good. The kids are going to have a quantiferon test overseas. The adults will not. Second one, by this, hope maybe you know this one now. All B-Waivers will have an abnormal chest x-ray in their EDN paperwork. True or false? Okay. The answer is false, right? primarily that's going to be adults that are going to have that abnormal chest X-ray. All right. So now we have a little case study. This is kind of typical. You review the paperwork you just received for a B-Waiver immigrant. It is an adult. The paperwork indicates that immigrant had a chest X-ray with infiltrates in the Philippines. Sputum smear ×3 and cultures collected in the Philippines were all negative, and the immigrant was not collected or not treated for TB in the past. Which of the below would you do in the first medical appointment you have with the patient? It might be more than one. And if you feel brave, you can put your answer in chat. Yep, very good. Good, good. You guys are getting the hang of it. Yes, correct. 2, 3, and 4. We want to see that they do not have symptoms of TB. We want to start working them up for maybe latent TB infection. And we want to get our hands on that old overseas chest X-ray if we can. So perfect, very good. So just what would you do differently if the patient had been treated for TB disease before arrival and you had really good documentation of that? This is a little bit trickier, but just throwing it out there. What do you think? Two. Good. Yep. So I think yes, very good. Probably what we would do is we would definitely do 2, make sure that they don't have any symptoms of TB, and then also 4. I see Heather put 4 as well. Yes, I would recommend doing both 2 and 4. So in that case, what we would want to do is we would want to go ahead and get the CD of the chest X-ray, and then we would send the patient for a new chest X-ray too, just to make sure that the TB has pretty much cleared itself out of the lungs and there's no indication that TB is still lurking in there. So 2 and 4 is probably the best answer, but 2 is also good. All right, any questions about this little case study? Okay. All right, this one is a little bit trickier. You receive a B-Waiver referral for a 3-year-old from Somalia. She had a positive QFT in Somalia. Her chest X-ray was normal. Her mom has a copy of the CD with the 3-year-old's normal chest X-ray. Which of the following should occur? I like it. I like it. I like it. This is a hard one. Okay. All right. I see a good range of answers here. And I think the thing of it is there isn't necessarily completely a right answer, right? So these are hard situations to navigate through. 3, I think, is for sure a yes, right? We want to get a new PA and lateral chest X-ray and ask the radiologist to compare the CD to the new one, just to be sure that this child hasn't developed TB disease on her way over, and to make sure that even that the overseas chest X-ray is actually normal. Chest X-rays for kids are very difficult to read. The abnormality can be very small. So I would not necessarily trust that that overseas chest X-ray was actually normal. So 3 is a really good answer. 4, obtain a quantiferon test. Yes, maybe, right? This again is tricky. Because she's from Somalia, you know, there is a lot of TB in Somalia. So the chances that it is a true positive quantiferon test are pretty high. Also, she's only 3, so we know her immune system maybe isn't working all that well. So the question is, if you get a new quantiferon test and it's negative, which one are you going to trust, right? You don't want to take any chances with the little 3-year-old. So that's going to be your quandary to figure out. And I don't necessarily know the right answer, but I think obtaining a new quantiferon test could definitely be a good idea. And if I got it back and it did not match the quantiferon test overseas and that it was negative, I personally might go to STIX and consult with an expert and say, hey, what do you think? Should we get another quantiferon test? Should we treat this child anyways? What should we do? Just to be on the safe side. So that's my take on it. And again, this is a tricky one, especially with kids. There's always not like a super obvious answer. And then, you know, if she ends up having a normal chest x-ray and the quantiferon is positive, truly, LTBI treatment with rifampin might be a great option for a child. All right, so I hope you enjoyed that tricky one. All right, so now we're going to go through a little bit about how the paperwork, the data entry works, or the TB follow-up form. So let's see. The way this kind of works is if you're getting the notification from us through Orpheus, you're going to follow this, you're going to find this TB follow-up form is uploaded into Orpheus. This is what we need you to complete. We don't need you to actually complete anything in Orpheus itself. This form needs to be filled out. You can fill it out by hand and then scan it in to Orpheus. Or, you know, if that's too hard, you could even fax it to us. That's okay too. So the form is kind of confusing. If you're not sure how to fill it out, you can just give me a call and I'll help you. Also, there is this EDN TB follow-up guide, and it does have explanations about how the different questions should be filled out. The numbers don't always match up anymore with the form because they've made some changes, but the guide is still very good and relevant. Most parts of the form should probably have something entered in when you fill it out. So just make sure you take a careful look at it before you send it over to us. So CDC does have reporting goals for us. And ideally, again, ideally, you would report to us multiple times what stage you're in. So within 30 days of EDN notification, CDC wants us to have completed that initial US medical evaluation. That is you all talking to the patient for the first time, your review of any overseas chest x-ray and treatment, and the new chest x-ray with comparison to old and sputum collection if needed. So ideally, again, I say ideally, within 30 days, that should be completed. And then within 90 days of the notification, CDC would like us to have decided what the diagnosis is and how we're going to proceed, and treatment for LTBI to have been started, or TB disease. And then you have a year to complete LTBI treatment. So those are the reporting goals. We try to meet them, but basically, from my point of view, if the evaluation happens and you do your best job you can, that's all we really ask for. Okay, I'm not going to go through that right now. All right, does anybody have questions so far? Okay. So I'm going to admit, I have not thought this through so carefully. The idea was that we were going to look at the paperwork and figure out how to fill it out, but I don't know how to put 2 things up at one time. So now I'm like stuck. Okay, hold on a second here. I'm just going to screen share the paperwork. While I'm going to quick write out what we're doing here. I'm sorry. No symptoms. 725, QFT positive, CD, 725 normal. Okay, all right, so we're gonna look at the paperwork and figure out where we put all this stuff. I'm going to screen share the worksheet. Okay, here we go. All right. Oops. Sorry, lots of things going on here. Okay, all right, so this is the paperwork. This is the worksheet that needs to be filled out. Let's see, lots of stuff on here. So one of the things that sometimes people forget to fill out here is C, and this is the date of first US test or provider clinic visit, so you'll need to fill that out. And then it asks about the TST. You'll need to fill out that. Asks here about the IGRA. So in our scenario, we did perform an IGRA, so we would go ahead and we'd fill in yes here. And then we would fill in the date collected, which was 7/25/18 right here. And we would check what type, which was quantiferon, and then the result, which was positive. And here we would check no. Okay. So this next section is where you put the answer to whether or not you were able to look at the pre-immigration chest x-ray. And again, sometimes they're not available, and that's okay. So in our scenario, I think we said yes. And I believe we said it was, no, I can't remember, abnormal. We'll say abnormal, suggestive of TB. So you could collect that, check that. And then again, we're always going to do, for the most part, a domestic chest x-ray too. We recommend almost always you get a new chest x-ray on arrival. So we would check yes there. You could put the date there of that new chest x-ray. And then you write your interpretation right here to check what happened. I think in our scenario, we said it was normal. So then for C8, you would go ahead and say it's improving in that example. But it could be any of these. It could be stable, worsening, or improving, or just altogether unknown if you didn't have the pre-immigration chest x-ray at all. Okay, any questions about that? All right. Okay, we're gonna click back to the PowerPoint. There we go. Okay. All right, so yes, our new chest x-ray was normal, so great, perfect. We've got all that. So we filled out the form. We did the best we could. I think we got it kind of together. Okay, so our little scenario continues. The B-Waiver immigrant is diagnosed with LTBI based upon the positive quantiferon test and normal chest x-ray. And the date is 8/9/18. We're gonna start the patient on 4 months of rifampin. Okay, so remember, this would be another point where you would usually want to submit the form to us. And we'll take a look at the form here again. So I'll stop sharing this. And sorry, this is a little cumbersome. I think the last time I gave this was in person, so it was just a little easier, but that's okay. We'll get through this. Okay, here we go. Okay. All right, so we're past all this chest x-ray part. It asks here also, you'll see if there was pre-immigration treatment for this person. We said no, so you would just go ahead and check no. It asks here if we collected, and this again, note for C12, it says US. They're not asking about the sputum that was collected overseas. They're asking if you collected it in the US. The answer is going to be no for our scenario here. All right, D1 here is kind of a tricky question. This is the evaluation disposition date. So this is basically kind of the day that you decided what this patient has, right? Do they have TB disease or whatever? So I would say that it's probably going to be for us 7/25/2018. That was the day that we got the normal chest x-ray back, because that's the day we, figured out the person has latent TB infection. So then you'll move on to D2 and you'll say completed evaluation, yes, and that they have latent TB infection, assuming you got all that done. D3 is a little different. We don't typically use these classification systems, but I think they're pretty self-explanatory. So in that case, we're going to have somebody who has LTBI. So that would be class 2, TB infection and no disease. Okay. Occasionally, very occasionally, we'll get somebody who's diagnosed with TB disease, right? That's why we're collecting sputum sometimes and doing all of that. If they are, you would, check here, class 3 TB disease, and then we have to get some information from Kylie about the RVCT number and some additional data. But again, it doesn't happen often. All right. So after that, we move on to E, which is US treatment for TB disease or infection. So in our scenario, we say, yes, treatment was initiated, yes. If you didn't initiate it, they have all these different reasons why you maybe didn't, so that's fine. And then if yes, we're going to say, yes, they were treated for latent TB infection. And then we're going to put in here our start date, which was 8/9/18. And then you go ahead and you specify which regimen you're using. We're using this one, the INH, 4 months before ours. So we click yes. And then at that point, the paperwork is almost complete. But like Wendy asked, you know, do we have to figure it out and wait until treatment is completed? The answer is yes. Unfortunately, this means the paperwork is going to kind of be open for another 4 months or so while the patient completes treatment. So when that's all done, then you would finally click 5, yes, treatment was completed or not, and you can put the explanation there. And then just a little bit more information here at the end. Okay, share my PowerPoint again. All right. So we already went through treating and how to figure it out, the completion and where to put it. All right, so any questions about filling out the follow-up worksheet? Doesn't look like it. Okay, good. All right, so sometimes I know you all get overwhelmed. I don't consider these B waivers to be your highest priority. And in fact, during the COVID response, we said that LPHAs don't have to do them at all. And we're still kind of in that era, right? So, you know, I think July 1 is the official date when we'll really mandate or, you know, require that you all try to follow up with all your B waivers. But even then, if you're overwhelmed, call me. This is something that can maybe be dropped to the bottom of your pile. Most important though are probably the B1s and the class A's because that person might have TB disease. A little less important are the class B2s and B3s because that's latent TB infection. So, you know, what I've been doing during COVID is for those of you guys who can't follow up with the B waivers, I've been sending them a letter. And that's been somewhat successful. I have gotten calls from some of the B waivers themselves or their providers asking what to do. So I'm happy to still do that for you until the COVID response ends, somewhat ends. You know, or even if you get overwhelmed, just let me know. I just want to let you know that you guys do get paid for doing the B waiver work. And that's happened since July of 2018. And we pay you about $300 for each workup for a B-Waiver immigrant. And we invoice you all quarterly for that. And you can send it back to us and we'll pay you all. And then also just a reminder too, that we reimburse you for quantiferon or T-spot test up to $150. Chest x-rays, I believe it's 50, although I can't recall off the top of my head. And we also provide free TB medication for all of the patients who have TB or LTBI. Okay, any questions about this whole process for me? Put it in chat or unmute yourself.
Heidi,
Yeah.
it's Renee and Carolee. Hey, from Clackamas County.
Hello.
Where do we stand with B waivers and COVID right now? Because when COVID hit, we really reduced the amount of work we were doing with our B waiver folks, just because we didn't have the resources to do the normal in-depth for a job we like to do.
Yeah.
But it, you know, COVID's, I'm not going to say it out loud because I might jinx us, but COVID seems to kind of be chilling out. So where do we stand on the assessment work, what we're doing for the B waiver folks?
Sure, okay, yeah. A couple things about that. So we didn't get many B waivers during COVID. So there's that piece of it because people weren't allowed to immigrate in. So we're starting to see them definitely pick up again. Yeah, so if you can do the evaluations again now like you used to, great, please go ahead and do so. Otherwise, probably as of July 1, I think per the director's office, things are going to be back in full swing most likely.
Okay.
So we would ask that you pick them up again July 1 for sure.
Okay, because I noticed we just got a new one today and I waited until we had this meeting so I could ask what we should be doing for, because we are starting to see a lot more of these folks come through, so.
Yeah. So if you can do it, if you can't, that's okay. I can send them a letter and, you know, hope for the best, fingers crossed.
Oh
But
yeah, we always send them a letter referring them to our health center for, you know, establishing care and for further assessment and all that. So, but we haven't been doing like them coming into the office so that I can do an assessment, get a history, draw the QFT, and then hand them their order form to go get a chest x-ray, you know, that in-person touch, which was a lot more successful in getting people assessed.
yep, totally. Yep, yep, I agree. Way more successful. Yep. Okay, great. Good question. Thank you. Any other questions? Okay. All right. I see we had a couple people just join. We're pretty much done with the presentation. So this has been recorded. So I'll send out the recording and also the PowerPoint after to everybody. If you have any questions, I think you all know where to find me. I'm always happy to help you work through these, and I know they're confusing. So, all right, if no other questions, we're going to stop. And thank you everybody for joining, and have a great day.